Hey, everybody. Hey, how's it going? Happy Monday. I'm like, what day is it? Who even knows? Hey, everybody. Hey, Miss Girly Pop. Steffi, we got Thomas, Natalia, Naresh. Hey, how is everybody? Hi, Christina. I am enjoying the spicy mango candies. I actually just had one a minute ago. Do you ever have like your favorite lotion? You're running out of it. You're trying to use every last little bit. Christy. I'm so glad that you're able to join. How's everybody doing? Just busy day. I was filming some stuff for the podcast. My girlfriend Shira is going to be on with us this week. And then she couldn't stay for the full time. Because of South by Southwest. So I answered some questions and chitty chat that way. Just been working on some scripts, doing some things. How are you guys? Oh yeah. Good evening. Hello. Hey, everybody. Yeah. Ask your questions in the chat. Oh, wonderful, Christina. I'm so proud of you. Finally started therapy. Yay. Make sure you like the person. Remember, we don't have to see them if we don't like them. Oh, Samantha, perfect timing. Just watching your videos. Wonderful. Oh, long time Kenyan. Hey, low key B. Hey, everybody. Hey, Christy. Hey, Nick. Miss Girly Pop. Oh, you said you've been Oh, and the podcast question. I'm an international adoptee and I deal with the trauma that comes with attachment and foster care. I'm waiting to try Zoloft for anxiety. Thoughts? Um, Zoloft can work. It's helped a lot of people with anxiety. I have to say, personally, for my patients and my patient experience, I'm not a doctor, so trust your doctor. Hasn't always been the best. I don't know if anybody else can relate to that. I feel like with anxiety, my patients have liked other medications better, but you have to do what's best for you. And find out what works best for you. I think in general, everybody's body is different. I do love the like cheek swab where it can tell you like whether or not a medication is going to work. It's not 100% correct and accurate, but it does give us a place to start. Oh, hi, Jose, or no, Josie. Sorry, sorry, Josie. You're a huge fan. I'm so glad. I'm so glad you could be here. But I think when it comes to anxiety, ask your doctor and make sure that it's something that works for you. Just trying things never hurts. Yeah, citalopram. That's what Thomas says. I take citalopram and I'm very happy with it. That's what I've heard. That's very effective for people to, yeah, no side effects. And that's the important thing. Make sure you ask about side effects. I feel like not enough people talk about that it's not just like, hey, is this medication going to work for me? You're like, hey, what side effects should I look out for? Because we want to make sure that we're okay with it and we're comfortable and, we feel like our best self. But yes, and welcome to anybody who doesn't know who I am. My name is Katie Morton. I'm a licensed therapist and I make mental health videos on here. I had a video come out today. Actually, really proud of this video. I did a bunch of random psychological research for you guys. I am talking essentially about why we kind of like relationships that are hot, cold, or connected, disconnected, and why we keep finding ourselves in situations like that. I thought, oh, hey, Ashley, Boston Volleyball. Hey, how's it going? I'll forever remember you as Ashley Boston Volleyball. I can't get away even though you changed your username. That's still who you are. Okay, let me see. Oh, first time joining, Kara. Welcome, Caramel. Cute. Okay. Let me see. Do we have any questions? Let's see. Okay. Brian is asking, says, what's the best way to navigate with a parent that is not emotionally available? You feel you had a decent childhood and he is no longer living to ask him anything. I think there's a lot of processing we can do, even if a parent has passed away. Like, I don't know if you guys all know, but my dad passed away when I was 24. And so there has been a lot of therapeutic work I've done about things that I wish he could have been a part of and things that I wish I could have said to him. And I think in general, when someone passes away, that doesn't mean that we can't still improve on our relationship with them. And I know that sounds weird. It's not about a current relationship. It's about repairing from the past so that we have a different perspective or a different feeling about that relationship. I hope that makes sense. And so I'd really encourage you to talk about it in therapy. Journaling really helped me. Writing letters, obviously, that you don't send, but writing them nonetheless, that was really beneficial. I think there are a lot of different ways that we can kind of process through the things that we wish we got or the conversations that we wish we had with them not being there. And I also want to, say that to people who, even if your parent's still alive, but they're not in your life, maybe you've gone no contact, maybe, they aren't accessible, maybe they've gone no contact, who knows what's going on. Everybody's lives are different, but if there's a reason that you don't talk to your parent or you don't feel like you can talk to them about it, it's really not about that. It's more about you and your process and how you can navigate or manage that relationship, if that makes sense. And so you have to do what you need to do in conversations with yourself and your therapist, etc. I hope that makes sense. And I found that really helpful, especially stuff with my dad. Just having those conversations that I wish I could have had, telling him that I'm like sad/mad that he wasn't there for my wedding and he didn't see me graduate from grad school, and like all the things that I wish he could have been a part of, and so that can kind of help a little bit too. Okay. Um, oh, Thomas says, I don't know why, but I have this feeling my therapist's father also passed away when she was young. I know it sounds strange. You might have picked up on something. We're empathic creatures. We pick up on things from each other. Okay. Um, Let me see. Okay, Josie says my counselor that diagnosed me with a BPD and generalized anxiety disorder. I only want to bring that up because I am working on some short video content about BPD, about self-injury, and things like that. So I'll be diving into that. It's on my to-do list today, so I'll be working on those a little bit later. Samantha asks, how can you reconnect with parents that I haven't seen or talked to in over a year? I think if we're wanting to reconnect, here, I'm going to scoot you guys closer so I can lean back. If we're wanting to reconnect, we have to be the one to extend the olive branch. And I don't know what caused the time, like the not talking for a year or not seeing each other for a year. Whatever caused that, if it was your decision, then you'll have to, say that you'd like to work on things. You'll have to again, extend that olive branch, whatever that means for you. If you were the one to decide, do it, then I think you can say, thank you for giving me my space and thank you for allowing me the time. I really would like to see if we can improve things. I also think that if it was them, then all we can do is just see if they're open to it. It's different if it's us that did it versus them, or if it was just like we had a big fight and we fell out and nobody really communicated, maybe we like kind of ghosted each other. That can happen in families too. It's not like it only happens in, potential romantic relationships or friendships. Then I think we just have to do the outreach. I encourage you to call or, see if you can come over. I'd call, not text. I know people love to text and message, but when we're dealing with really emotionally sensitive things, I do believe that like a phone call is much better, because you can get confused about like the inflection and the tone, like how are they saying it? And let's just make it as clear as possible. Let's call. And that would really be my best advice. Yeah, and I'm hopeful for you. I think in general, when anybody wants to kind of rekindle or repair a relationship, I always hope it works out. And I think just being as honest as possible and clear is going to be really important. And why you want to reconnect. Be like, I miss you guys, and I know that we had some tough conversations, and I know things were said. You can apologize if there are things you wish you didn't say, and hope that things can come back together. Okay. Let's see. We got tons of questions rolling in. Okay. Let's see. Okay. Katie, great name, by the way, Katie, says, any ideas on what to do with suicidal ideation, but I have med-resistant depression and cannot get off work for ketamine treatments. You're welcome, Sam, or Samantha. Sorry, I don't know if you like to go by Sam. Keep me posted, okay? If we have treatment-resistant depression, there's a couple of things. First of all, I'm not a doctor, but I'm going to give you the options that I know of, okay? First of all, ketamine's great. I'm glad you brought it up. There are like other ketamine treatments like Spravato, which is like a nasal spray, and you don't have to go for an infusion, so you don't have to get the time off. And that might be something that I'd look into, maybe ask your doctor. So just throwing that out there. Another thing is, and I'm going to throw out TMS therapy. That's not going to work for you either because you need time off for that. But I just want to put that out there for anybody else who's looking for alternatives. There's transmagnetic stimulation, or TMS therapy. I actually would love to get somebody on the podcast to talk about that. I'm going to put that on my list. TMS specialist, because I think there's so much that I don't know, and I would love to learn along with you guys, and so that we all know. So there's that. But when it comes to treatments things like Spravato. When we have depression and people say treatment resistant, I'm curious how many things you've tried or what you've tried, because I will tell you that a lot of my patients find benefit from having like an SSRI or SNRI, like an antidepressant, something like a Zoloft or a Prozac or insert whatever thing. And then adding on what they call an atypical, which is really an atypical antipsychotic. I don't want the name to scare you, but at a low dose with the help of an antidepressant, it's been shown to improve our depressive symptoms when an antidepressant alone wasn't enough. Those are things like Latuda, Abilify, Seroquel. There's another newer one that I'm forgetting, but anything like that. And I also want to throw out there that for some people, I'm not a doctor. Again, talk to your doctor, but medication for ADHD. And I know that sounds wild, but they are stimulants. And I cannot tell you the number of members of our community and my patients over the years who have found antidepressant effect from taking something like a Vyvanse or an Adderall. And depending, obviously, if you have any addiction, things to consider. But that has been like, oh, you did try them. Okay, Katie. Wonderful. Now, all that being said, there's a ton of different medication options. I also want to encourage people to maybe do the cheek swab, Katie. And I also am curious, this is something that I always do with my patients when they say they've tried everything. I'm like, how long were you on them? Because sometimes a doctor will switch us too quickly, and I don't feel like we've given it a fair shake to see if it actually is effective for us. And the reason I say that is because sometimes we didn't increase the dose high enough. Yeah, aripiprazole is the newer one. Yeah, it's aripiprazole. That's Abilify. Yeah, thanks, Pigeon. That's a great thing to mention. And so there's that. And then I don't want to. There's two other options, Katie, I'm going to throw out here. Number one, vagus nerve stimulator. I had a patient years ago in the hospital. I've shared the story, and I only have one N in my study, okay? However, it was life-changing for her, so I will keep telling her story. She had constant suicidal ideation, tons of attempts. Things were really difficult for her. Depression just wouldn't go away. And she had a vagus nerve stimulator, VNS stimulator. It goes, the reason I keep touching here is it goes kind of by your collarbone, kind of in here, if I remember correctly. It's like a little implanted device, and it just buzzes your vagus nerve and stimulates it, and it improves your mood. And when I tell you that this was a life changer for her, she went from having all these attempts and suicidal ideation constantly to not. And we were honestly, obviously thrilled, but also like floored, like, oh my God, this is amazing. Again, that's one person, but if it works for one person, that means it could work for another. And so vagus nerve stimulators are something I always like to mention. And then there is ECT. I've had patients do it, electroconvulsive therapy. I know it like sounds barbaric, and then back in the day, they make it look really crazy. These days, it's not as wild and it's not barbaric. The side effects are that you really struggle with memory around it. So usually the day of an ECT treatment is going to be a little foggy, and probably, for like 24 hours, your memory's not that great. And so I think that's another option as well. I'm just giving you all the options. There's tons of research depending on what state you're in into things like psilocybin treatment or like you said, ketamine, even MDMA. They're doing some research into that improving your mood. I really don't want you to give up hope. I think there are alternatives. Like the vagus nerve stimulator is one of my favorites, and I think it can really, really help. Okay. Um, okay, let me see. Do-do-do-do. Okay. Oh, I'm sorry, Nikki, to keep you up. Says 10 p.m. here is about to go to bed. Well, we're just gonna hang out for an hour, so I hope I don't keep you up too late. Okay. Let me see. Miss Girly Pop says, is it bad that I tell everyone I love them? I only tell people I truly love, and I don't want to regret not saying it one day. But I tell my physical therapist I love her because I truly do. But is it odd? I don't think it's odd. I'm kind of with you on this. I've been trying, not trying. I've just been telling my friends that I love them more because I do, and I don't think that we should be so. It should be a weird thing to say to a friend. Love is love. It doesn't have to be romantic, you know? I don't think there's anything wrong with it. The only thing that my little therapist spidey senses, like, just have to say it because my spidey senses are, tingling a little bit, is that I will always remember I had this patient when I was training. This is like between undergrad and grad. I had an internship. where I worked with children because I thought I wanted to work with children and then quickly realized that I didn't. Not because I don't love kids, but parents can be really difficult. Anyway, she this young girl, um, er, really had a tough time having any boundaries, and so she would tell everyone that she loved them, and then she'd hold their hand, and she'd, like, walk with adults, like, if she didn't even know them, and so a lot of the work that we did, and not even work that I'm doing, like, I was with my essentially my boss, but I was like I don't even know if I was really a trainee because I hadn't started grad school yet. I was about to, but I hadn't. Um, anyway, I was, like, shadowing a lot of the work that she did with her was learning safe and unsafe people and how to test that and how to have healthy boundaries within her life because we were afraid that she would put herself in a situation where she'd be, could be harmed. And she was young at this point. She was like 8 years old. And I only bring that up to say that sometimes if we overshare with people and connect too quickly, it can be an indication of us maybe not having any boundaries in our life. So just a good check-in to see how we navigate that. Also knowing that some people are going to be for us and with us and others aren't going to work. But overall, I just had to throw that out. But overall, I think telling people that you love them when you do is a beautiful thing and something we should do more of because like you said, you don't want to regret not saying it. And I think it's powerful to tell people that we care about them. Um, yeah. I guess that's my question to you about the boundary thing. Other than that, I think it's fine. So I don't think it's weird. I think, telling the people that we love them is fine. Okay. Jessica asks, how do I bring up my eating disorder behaviors to my therapist? I'm terrified she'll refer me out or blow it off. Good question. I guess, I mean, we can't control other people. We don't know how they're going to react. My advice to you is to get yourself to a space where this is hard to say, but like you'll be okay no matter what your therapist does. Because I will say, if your therapist blows it off and acts like it's no big deal and you know it's a big deal, then I would encourage you to like double down, to say something more, to have like be like, no, I'm really concerned about this. I really am looking for help with this. Like, however you can communicate that, I would encourage you to double it down if you feel like it's blown off. And if you still feel like she's not taking it seriously, then I'd be concerned as to whether or not she's an effective therapist for you, if it's like a good fit or not. Um, but when it comes to telling a therapist, I always tell people, you don't have to say it perfectly. You don't have to know exactly what you're wanting or what's really going on. I encourage you just to lean into, um, oh, is this the same? I don't know if Stephanie, oh no, it's Jessica. Stephanie said, I have an anus or attended Renfrew, which was a virtual and in-person clinic. Yes, I'm very familiar with them. But I think when it comes to telling a therapist, just tell them what's bugging you. And you can say it straight up. I mean, you might want to practice. Sometimes it's helpful to, especially if we haven't told anybody we have an eating disorder, saying those words or talking about behaviors can be overwhelming and we can like dissociate or we can feel like that's just too much. Well, we kind of shut down. So I'd encourage you to practice by journaling it. Maybe say it out loud to yourself in your car or wherever you have privacy so that you kind of get used to saying the words. I know it might sound a little bit crazy. Yes, Ashley Basta said write a letter. It can help sometimes to write to your therapist and then just give it to them. And that can kind of give you a little bit of space, allow you maybe just take a beat so that you don't feel like you have to say it all. It's already going to be said and they can read it at the beginning of your next session or in between. I don't want to assume they'll have the time. Some therapists are like, I'll read it, with you in the room. I know that's uncomfortable, but it at least makes sure that your point gets across in the way you want it to. And then just talk about the symptoms, the things that are bugging you, the things you don't want to do anymore. Because I find with eating disorders, it's not always common that we like want to get better. We might actually feel like we don't, but it's very common for us to not like where we're at, to be like, I don't like feeling this way. That's all we really need. And so I think that's my advice, and you'll be okay. Even if your therapist, acts like it's not that big of a deal, I encourage you to, what's a big deal for you and not. And if your therapist wants to refer you out, they don't do it that quickly, by the way. It wouldn't be like, oh my God, you have an eating disorder, I have to refer you. That's not really how we respond to things like that. We'd want to gather more information. And you could even say, I didn't want to bring this up because I didn't want to have to go into treatment. I don't want you referring me out. I want to see you. We can be honest about that. And I really would encourage you to make sure you say that, just so you're kind of like assuaging your fears along the way versus just like verbal diarrhea, vomit kind of thing. And then like, you know, hoping that she doesn't do something. Let's just tell her. Let's just talk to her about it. Okay. Let's see. Do-do-do-do-do. Mhm. Oh, okay. Nikki says, let me ask, what is supervision for a therapist? What is it like and why do you need that? In general, so supervision starts before we're licensed. So in the state of California, where I first got my license, I'm also licensed in Texas, but in California, you gather 3,000 hours towards your licensure. Yes, 3,000. And you have 6 years to do it. It took me 5. Um, and during that time, you have to have at least, it's like a ratio. And I think I want to say it's like 10 or 15 hours of patient contact for 1 hour of supervision, or maybe it's 20 to 1. I forget, to be truthful. And I'm so sorry, it's been a while. But you have to have an hour of supervision for a certain number of patient hours. Okay. So for every time I sit down with someone and have a session, I have to have supervision to keep that going. So, and they have to sign off on my hours. And supervision is really like you, first of all, you have to let your patients know that you have supervision and they have to sign saying it's okay for you to share it with your supervisor. And then in those supervision times, what you're really doing is you're talking with that therapist who's licensed about your patient, what they're working on, and what you think your treatment plan should be. And they're kind of just like your mentor. They're guiding you, making sure that the treatment is appropriate, making sure you're doing all the things you need to. And essentially it's like training wheels. Like you're in training and you're getting better and better and better until you get licensed and then you don't need it anymore. However, a lot of therapists, myself included, even out after that supervision that was required by law, I still had, we called it a journal club, but I was part of essentially like supervision with other clinicians. So there were like two psychiatrists, sometimes three, a couple of therapists like myself, a psychologist, a social worker, yeah, a bunch of different types of mental health professionals. And we would get together once a month during lunch hour, and we would talk over difficult cases. And in that instance, because it's not the other version of supervision, this, you change all the things, like I'd change the gender of my patient so they wouldn't know, or change their job. I would, instead if they were a lawyer, I'd say they were, secretary, just change things up so nobody knows who they are, but the issues stay the same. And that allows you to get some support that way. So a lot of us do that. Yeah, that's what it is. Okay, let's get back into your questions. How can I, okay, how can I stop repeating arguments from my past in my head over and over? This is a great question. There's a couple of things. Number one, we know for rumination, that's what that is. When you like think about something over and over and over, we call that rumination. And rumination in general is an anxiety driven behavior. And so for me, there are a couple things that I do to stop myself. And sometimes it still happens, but these are my go-tos, okay? Number one, and everybody probably saw this coming, is that I journal. And I know that sounds kind of silly, but I get out what the thing is. Okay, so I've had this argument, so I write about that, but not for long. I only give myself like 5 minutes or less. We're not going to ruminate. We're just going to get it out, and then I force myself into a different perspective. So seeing it that like, okay, I'm glad that happened and it's done, or I realize that I should have said this way. Okay, and I'll learn that, and I start applying it to the future, not the past, because we can't apply things to the past. We can only apply things to the future. So I'll consider, like, in other relationships, I think it's really important that I'm clear about my expectations, because I wasn't, and that cost me that, and I had that argument or whatever. And then I also, and this is just me, this is how I journal. So after I've kind of gotten that stuff out, I still don't spend that much time on it. Then I force myself to move into things that I'm grateful for and things I'm looking forward to. And you might be like, Katie, why? Because I don't want to be stuck in rumination. Why would I want to journal more about the thing when I'm already thinking more about the thing? It's like taking my rumination and putting it onto paper. And so we don't want to spend that much time doing that. We want to move into things you're grateful for, the things you're looking forward to. And that sounds kind of silly, but I swear to you now, I've been doing this for probably a year or maybe more now. It didn't take it this long to be effective, by the way. But then when I come into contact with a difficult situation, maybe someone's rude to me, maybe I get into an argument with somebody, maybe I have a falling out with a friend, or something just doesn't go my way, my brain legitimately follows that pattern. It like thinks about it for a little bit, and then I'm like, but I'm really grateful that I had that, and I'm glad I know this up front. I start moving into gratitude, and then I'm like, you know what I'm really looking forward to? I'm looking forward to having more time for other friends that are better than that one, or whatever. It, I swear to God, is changed my mind. And so that's my number one go-to Again, don't have to spend a ton of time. I think at max I spend 10, 15 minutes journaling sometimes. And I encourage you, as I do with myself, when you're having a really shit day, that's a day you have to journal. If you're in a funk, you're thinking in a negative way, you find yourself going back to think about that again, that's a day you journal. You don't have to journal every day. I try to do like 3 times a week, if I'm honest. Sometimes I don't for a while and I feel it. And so I really want to encourage you to journal. The second, because I said there were two, is because it's anxiety driven. I find if I do a body shake, really shake out, stomp my feet, like a dog out of the bath, that can kind of help move that through my system so that I don't keep thinking about it over and over. Okay. Let's see. We have a question from Jen or NJ Jen. I don't know. Says, hey, Katie, everyone. I just started college at 60. Amazing. To get my BS in psychology. I want to become a dramatist. I love how effective it is. I'm not that familiar. You'd have to tell me more. But I love that. I love the thought of going back to school. At any age. I actually, just complete candor, I didn't even plan on sharing this at all, but why not? People need to share the ups and the downs. I actually applied to get my PsyD, my doctorate at Pepperdine to go back, and I didn't get in. And I they're very competitive. I got to the final round. You have to do interviews and stuff, but I wasn't accepted. And I think it's, again, going back to what I was just saying about journaling, I had the weirdest experience when I got the letter saying I wasn't accepted because I wasn't I wasn't even disappointed. I don't know if that's really the right word. I just felt like, oh, that wasn't meant to be. It was so weird, you guys. Usually I'd be like emotionally stirred and upset or I mean, I was bummed out. I think I was more shocked that I didn't because I really tried hard and I think I think I should have gotten in. But in my head, I was just like, you know what? It just wasn't meant to be. I don't know how I would have fit it in my schedule between you and I, but that was my thought process. And then I was like, I'm grateful for this redirection. I'm grateful that this didn't turn out the way that I thought because I know something better's in store. And I know that might make me sound like a little delusional, but sometimes that's like that journaling practice helps pull me out of that. But I love that you're going back to school. You're going to be amazing. Your patients are going to be so lucky to have you. And I'd love to hear more about the psychodramatist. Oh, psychodrama is very cathartic. I call it healthy purging. I love it. I love it. Amazing. Okay, let me get back into more questions here. Let's see. One of them's in Russian and does it translate? How come it's not translating? That's frustrating. I don't have a way to translate. I'm so sorry. Okay. Um, Steffi is asking, says, why do I struggle so much when I have to slow down? Oh, good question. I recently broke my shoulder and I'm at home and having to rely on others, and I'm really struggling with that. You don't happen to be an eldest daughter or a parentified child, do you? I'm just saying, because we are the ones that have the hardest time with it. And you're not alone, first of all. I think there's a ton of us who struggle with receiving help. I'm one of them too. It's hard for me. I write about it in my most recent book, Why Do I Keep Doing This? Where I'm like, it's really hard to first to ask for help and then second to like receive that help is even harder. And I think part of it, I'll speak personally and I'll kind of weave in like what I know as a therapist, and you'll have to let me know if this resonates, is that I believe that if we grow up thinking that it's like we have almost like avoidant attachment style a little bit, and we think we can only count on ourselves. We have what I call toxic independence, and I'm guilty of this, okay? Where it's like, I can't depend on anybody else. I can only depend on me. And that's probably because, like, for me, for example, I'm not the oldest. My brother's older, but I'm the only daughter. And I like took care of him, like making him food. Oh, yes, to the second, but I'm actually the youngest. Yes, me too. Okay. And the age gap. And my mom really relied on me. Yes. So there's that, the parentified child piece, right? And so that the fact that you felt adult from a very young age means that you never got to have someone take care of you. So we don't have that experience. And I think that in general, that means that as we get older, when we do need help, like you said, you hurt your shoulder, you have to have somebody help you. You're like forced into a position you've never been in, and it feels really uncomfortable. And I use the word uncomfortable because it's not unhealthy to rely on others from time to time, just as we, as usually the givers and the caretakers, would love to like, we love to take care of people with part of what we do. Is also part of how we like earn our worth. We think that in order to be worthy of a relationship, we have to give. And that's something that I've been personally working on in therapy for years, is like untangling my worth with my productivity or my ability to care for others. Asking for help is more painful than the shoulder break. I totally get it. But I want, if you can change your perspective, I'm going to challenge you, Steffi, to, instead of seeing it as like a weakness or I'm putting people out, all those automatic thoughts. I don't know what yours are. I'm just giving you essentially the ones that I think of. um, I want you to try to see it from a different perspective where you're like, this is a wonderful opportunity for me to give someone else the pleasure of helping me in the same way that I usually like to give it to other people, right? To see it from the flip, to be like, hey, I'm usually grateful because I feel like, for me, now I'm speaking personally, that I have to earn my worth. I have to hustle to be worth people's time and energy. And then I'm giving someone else an opportunity to do that for me. And I know it's a hard swippy swap. It's a hard like to change that perspective, but it will really be, it's a, you have a great opportunity for therapy right now. It's like to do this internal work on yourself. I encourage you to be curious and journal, or at least think about what comes up for you when people offer help. What's the story you tell yourself about receiving that help? And why does that only apply to you and not others? I know I'm making some assumptions there. No, hi, Samantha. But those are some of the things I want you to unpack, because I personally have found that to be really helpful in my um saying no when I mean no, in my balancing so I don't burn out, like not putting other people first, not lighting people on fire to keep them warm, It makes a lot of sense. Yeah. Do some journaling, do some thoughts about it. And I encourage you also to do kind of the opposite action. Like, even if you don't want to ask for help, but you know you need it, I want you to ask for help. I want you to do that. I want you to lean into this a little bit, and then notice how you feel. We need that support. We need people to do things for us. You can't do everything when your shoulder's all messed up. I know easier said than done, but keep us posted. Okay. I know it's hard. Okay. Um, let's see. Okay. Stephanie's asking, what is energy therapy and how would therapists use it in their office? I am not familiar with this, Stephanie. That's a good question. Is this like Reiki or something? I've never heard of energy therapy. If anybody has, feel free to leave it in the chat for Stephanie. Um, I'm not sure. My brain automatically goes to like Reiki, which is not, I mean, I guess someone could be a licensed therapist offering it, but it's not a therapeutic treatment modality. That's not something I'm familiar with. Um, okay, let me see here. Do, 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 do. Okay. Oh, okay. Jen says someone here asked why therapy is important after bariatric surgery. Great question. For me, I had gastric bypass in 2021 and my body image is the worst it's ever been, worse than before my surgery. And a lot of people I know feel the same. This is a great question, a great conversation in general. And I was actually I don't know if anybody else saw the interview. I haven't watched the full thing, so I need to. But Jillian Michaels, sitting down with uh, people and talking about weight. Have you guys seen? I don't know what it's called, what the title of it is, but it's Jillian Michaels recently had like I don't know, conversations or roundtable with a bunch of like eating disorder therapists and stuff like that. It's been going around the internet. And anyway, there was a lot of talk about um oh, it was on Jubilee. Okay, cool. I'm like, I don't even know where it was. I just saw it on TikTok a lot and I haven't watched the full thing, other than clips. And when it comes to bariatric surgery, for whatever reason in our society, we believe that eating disorders mean underweight only. Now, I know we've talked a little bit about binge eating disorder and the fact that we can, even with, bulimia, or even eating, if we have EDNOS, it used to be called, but why can't I? Why am OSFED? Yeah, otherwise specified eating or feeding disorder. I'm like, why am I blanking? Any kind of eating disorder can it we can be overweight and have an eating disorder. Binge eating disorder is real. And I think that when we have bariatric surgery, we're kind of fixing the physicality of it. Like, okay, I'm going to lose weight. I can't eat as much, right? Because for my health, it's like going on a GLP-1 that everybody seems to be on these days. Um, we can quote unquote fix the problem, but we're not fixing the problem, the real problem, the thought process, the relationship that we have with food. And we, in order to heal ourselves and to heal our bodies, we need to do more than just a surgery. We need to be understanding. Otherwise, we will gain all the weight back and go right back into the same behaviors. And I've even had patients and members of our community who told me they've had like complications because of this. And so the surgery doesn't really fix the problem when it's a mental disorder. Eating disorders are a mental illness, and so it needs to be treated as such. And I believe that that's why we have to have, therapy in conjunction with it, because we have to, you know, we have to understand our relationship with food, and we have to repair that. Whatever, because eating disorders, for anybody who, hasn't learned this or heard me say this before, eating disorders are a coping skill. They're a way for us to better manage things that are going on in our lives that we don't want to feel or think about. It could be past trauma from growing up. It could be when our stress levels increase, we lean into food. It could have been behavior that we learned through our parents, that this is the only coping skill that they used. And now when we feel depressed or stressed or sometimes even really excited, it makes us worry something's going to go wrong, right? There can be a zillion different reasons. Yeah, exactly. Honeybee says food is a drug of choice. Yes. And they call certain foods comfort foods for a good reason. They actually release dopamine in our brain and it hits our reward system. We feel better. And so there are a ton of reasons why we need therapy in conjunction with bariatric surgery. I truly believe that anyone who is extremely overweight and has struggled with it for a long time does have an eating disorder. It needs to be treated as such. We can't just treat the symptom of the weight and think that that's going to fix things, right? That's why diets, people like yo-yo. That's why I don't really approve of any kind of diet. Um, and that's why I think like GLP-1s and bariatric surgeries can be helpful, but they need to be part of a more holistic plan. No judgment here on either whatever you think about any of that stuff, but but therapy should be a big piece of it. And so those are really my thoughts. I know people can be very sensitive when it comes, especially if you're overweight, when it comes to people talking about it. And the reasons people get so emotional and are so sensitive is because it's been probably so callously dealt with over the years. I find like medical professionals, you can go in. We had a member of our community almost have her appendix burst, and no doctor would take her seriously because they're like, we just need to lose weight. And she's like, no, this pain is different. Like, I know my body. Hello. And that almost happened. So rightfully so, people can get very sensitive, feel very emotional when it comes to talking about their weight, because for so long, they probably had conversations and situations where everything was blamed on it, where maybe relationships were sullied because of it, misjudged. There's tons of stigma. And instead of seeing it as an eating disorder and a way to cope and treating it holistically, so I understand why people get really sensitive, but I just want people to know that it's really common, and getting that extra therapeutic support can make all the difference. Okay. Let's see. Do, 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 do. Okay, Thomas says, I have really bad IBS. I'm so sorry, and I can't stop emotionally eating. My therapist doesn't use CBT techniques. What can I do? I guess I would be curious, Thomas, about the emotional eating. Obviously, we have IBS, and that's not, that exists. That's part of what's going on in our body. And so we're going to have to find better ways to manage it. I know that we do tend to sabotage. Like, it sounds like you're kind of sabotaging how your body, when you emotionally eat, because you already know you have IBS, but then you probably eat things you shouldn't, and it makes it flare up. And that's not uncommon. That's the reason I'm saying it. I don't know if that's to be true, but that, happens with a lot of my viewers have told me about this. And even my friends, I have some friends who struggle with that stuff too. So I'd be really curious about your emotional eating, and when you say you have emotional eating, what does that mean? Um, is it that, are we trying to punish ourselves? Because I've even had patients who use emotional eating almost as a form of self-harm, especially with IBS and other issues. Um, like, we want to cause issues for ourselves, and we want to feel pain physically that we feel emotionally. Just throwing it out there. I don't know, just as we need to be curious, not judgmental about our eating and why we're doing it the way that we're doing it. And so if you're struggling with this and you feel like, I have IBS and I keep doing this thing, like, let's be curious, figure out what purpose it's serving, and see what we can learn. I guess it doesn't have to be CBT techniques. It comes up a lot when I miss my therapist because of my attachment issues. So that's you're coping that way. Gotcha. So it's soothing. So my challenge, I guess, Thomas, is to try to find some other ways to soothe. Maybe it's through, and this is going to sound maybe weird or silly, but whatever. Maybe it's through journaling, I'll throw that out there, but maybe like sometimes like the stimming behavior that we link to like autism, like rocking, can be soothing. Remember when you're a baby and you get rocked in a rocking chair? That can be really nice. So some of that repetitive behavior, going for a walk can do that for you. Taking a warm bath, any kind of self-nurturing that you can do might be beneficial. And you can try other things too. Those are just some of the things that come to mind for me, especially when it comes to attachment and soothing our system. Because when you feel overwhelmed, you comfort eat. And so I want you to find other ways to soothe. So my challenge is to try at least four. I know, seems like a lot. Four other things to try to help you soothe before you go to the food. Just give it a try. And if four is too much, we'll try two, wait 30 minutes, then you can do it if that's easier. But I want you to just try it because I think there's other things we can do to help self-soothe that doesn't have to come with food attached. Of course, honeybee, I'm so glad that you're learning so much. It's wonderful. Okay, Andrea says or asks, "Hi, Katie. I feel okay most of the time, but after sessions with my psychiatrist, she is great. I feel really sad without any reason. Why could this happen?" Sometimes when we talk to mental health professionals, it can kind of like open up a Pandora's box. Meaning, if anybody's a Friends fan, the show Friends, I always loved Monica's closet. If anybody knows, it's like this closet because Monica's a clean freak, but she has this closet where she like throws things she doesn't know what to deal with in, which is very like you can see metaphorically how it's like the things that we repress, right? So she has this closet, and when she opens up, it's like a disaster, and they're like, "Oh my god!" And it's like complete chaos, and she wants it to stay closed. She doesn't want anybody to know about her closet. And so I think sometimes I say that because when we go see our psychiatrist or our therapist and we really like them and we share with them, it's like someone's opening that closet and we're like, "Oh my God, oh my God." And then we don't know how to put everything back. It's almost like we've opened up some of the things that are upsetting for us or to us, and we've made ourselves more vulnerable. And then we don't know how to like go back about our day. And so I have a couple of pieces of advice. Number one, I would let your psychiatrist know that this is happening because what I do with my patients, especially if we're doing like trauma work or any kind of deep processing work, I will have them. Oh, sorry, just making sure I'm not missing anything. I will have them. We'll keep time towards the end of session to kind of come out of it. And so usually they'll start with me. Like we'll do some grounding techniques, like look around the room and how many things start with the color blue, or how many things are blue, black, brown, or how many things start with the letter A, B, or C. We'll do some of the grounding stuff, and then I'll move into lighter topics. Like things like, "Oh yeah, you said that you had that presentation at work. How did that go?" Or, you went on that trip with your girlfriends. Tell me about that. I'll go into something lighter and talk about that until session ends. So giving nurse a little bit of time to kind of package that up and put it away so that it's sealed up for next time. You can also, I did this with my therapist when I was doing internal family systems or like parts work type of therapy. She had me imagine a box or a container of some sort that I would put my emotions and experiences into until our next session. And she would have me visually imagine that I'm like dumping that stuff in and then locking it up. Whatever that looks like for you, or however, whatever your box or container looks like, that was really, really helpful for me. So something like that to kind of finish the session and close it up will prevent us from leaving our therapy or leaving our appointment with our psych and feeling even more like stirred up and more upset. And if you also need to sit in your car for a little bit and, kind of decompress, that's okay too. I also want everyone to know, oh, Samantha, welcome to the Inkwell Club. Yay, yay. I also, want everybody to know that like, it's okay to not have anything else for the rest of your day after therapy. I used to have my therapy on Fridays at 3 o'clock and I didn't do anything after. Because it's kind of, when you're kind of open yourself up like that, you can be kind of exhausted and it can feel overwhelming. And you're like, I can't really do work after that. And so if you can put it on a time and day when you can pretty much have nothing left to do, I'd encourage you to do that too. Okay, let's see. Where Love Blossoms says, "How does someone get into our head to the point of manipulation, even if we are intelligent and have insight on issues?" Unfortunately, if people are master manipulators, Well, there's a couple. I guess it's less about how does someone get in and more about how do we make ourselves like manipulation proof. Because I think there's a big piece here where if people like kind of love bomb us, like if things move really quick or they give us a ton of affection or attention or act like we're perfect in certain ways and kind of like, shower us with all the compliments, if things move really quick in general, that should be a red flag for all of us. Like, whoa, 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 because that's usually the number one way that people try to get into our heads and make us more easy to manipulate, easier for us to, get us to do things that they want us to do. And so it's not about us not being intelligent. Actually, manipulation has nothing to do with that. It's more awareness of how things are moving and what someone's doing. And so if you feel like someone in your life is moving things really quickly or is gaslighting you, like you're remembering it wrong, we have to pay attention to what we know are manipulation tactics. The number two, the top two, especially those with narcissistic personality disorder, is love bombing and gaslighting. Um, I think in general, those two are the ones that you need to look out for the most. And so I think that, that's how we prevent it is by being more aware of it. Okay. Let's see. Um, okay. We have a question. How to know that my DPDR, so depersonalization, derealization, otherwise known as dissociation, is anxiety based or a disorder on its own? I think it's always its own, because it is its own diagnosis and it doesn't fall under an anxiety disorder. However, I would say that your anxiety triggers it. Does that make sense? Because I should have got my DSM. I need to get a bookcase in here, but I'm on a budget. So my DSM, it's in the other room where we had the bookcase, would probably say it better. But what I want to say is that dissociation is not part of an anxiety disorder diagnosis. DPDR on its own is its own diagnosis, and it's usually triggered by something else, meaning that we dissociate because of our trauma. We dissociate because of our anxiety. We dissociate for whatever the trigger is, right? And so for you, I guess you'd have to be kind of curious, not judgmental, about like if you think you have like a really high anxiety day and then dissociation happens more frequent or it just is happening all day. You'd have to kind of pay attention to the correlation between the two. Because yes, we can get a diagnosis of them separately, but I find that almost always our DPDR is going to be triggered by something else like PTSD, like anxiety, um, even big bouts of depression. I've had patients who struggle with depression and that will trigger it too. It's essentially we usually dissociate and doing that, like your brain pulls the ripcord on reality, you kind of whoop, go out. Um, they I believe that in general, it just happens because our system, what's happening to us in the moment is too much for our system to manage. Therefore, it pulls the ripcord. It gives us a little bit of kind of space between ourselves or space between us and our environment. And so, yeah, it can really trigger a dissociative episode. And so I think that it most likely is on its own because it's not part of a diagnosis of anxiety, but the anxiety might trigger it. Okay. Um, okay. My cat's minion says, "Hi, Katie. Is it normal to have an eating disorder is it normal to have eating disorder thoughts again after recovery? I ask this because I'm in menopause and I'm feeling vulnerable and worried I might relapse." It is normal, I would say, when you get really stressed out and when things are changing. Um, it's our brain and body's like it remembers that that's the way that we coped, and so it'll go back to it. However, your tools and stuff are still there, so I want you to lean on them. But I do want to throw it out here because you talked about menopause. Hormones shifting can exacerbate any other mental illness we used to have. It can make it feel so much worse. And so I really want to, oh, thanks, Matilda, that mad Matilda, that's really sweet of you. Um, the, that's really thoughtful. So I want you to know that, the, hold on, that when we have menopause and when our hormones go wild. I actually did a bunch of research for the podcast probably like 2 or 3 months ago now, and I learned so much, you guys. I do want to have a specialist. I'm putting outreach out there to try to get a doctor, somebody who specializes in menopause and perimenopause. Dr. Marie Claire is one of the people I'm looking into. But anyway, to come and talk about that because I learned so much that like during menopause, it can even affect how well our medications work. Like if we have ADHD meds, they found a correlation between women going into perimenopause and menopause, and then their medication not being as effective. What? Why aren't we talking about this more? And so all that to say that yes, I believe that shift and that transition specifically for women in menopause can cause, our mental illnesses from the past. We feel like we're already in recovery. It can cause them to kind of crop up again. But I encourage you, maybe get back into therapy for a period of time. Talk to your doctor, let them know because like estrogen patches and things like that can help alleviate. But we want to make sure we have our tools and some resources available that can keep us in recovery so we don't, relapse. But hang in there, yeah, it can just be menopause and perimenopause have so many effects on us hormonally, mentally, mental health wise in general with our mood. And I really don't, I'm going to try to get somebody on so we can really talk about that because I think it's really important that we know. Um, okay, Rebecca says, I was recently diagnosed with BPD. How do I know if it's right? This is a great question. Here's a couple of things, I guess. If because and also I don't know how long they saw you. I'm always suspicious if somebody sees a therapist or psychiatrist once and gets this diagnosis because BPD is not something I believe that can be diagnosed quickly like that. I think it takes time. It can be something that we believe to be true, and then we're kind of looking to either prove or disprove it along the way. Um, yeah, and so I think if it's BPD, okay, I'm just going to tell you some of the things about BPD, and you can say, yes, this relates to me or no. If it's BPD, we worry all the time about people leaving us. Our fear of abandonment is high. And this doesn't mean that the abandonment is real, it could be perceived. It feels real to us. So that's number one. We worry so much people are going to abandon us. I also think an incredibly common symptom, yet something that's not talked about enough, is we can struggle with a sense of self. We almost feel like I've heard from a lot of my patients and a lot of our community members over the years that like almost like an imposter in our body, or we can feel like I don't really know who I am. It's almost like we just struggle with our identity. And I don't really want to I'm not everybody experiences it differently, so I don't really know how to explain it. I've just heard it explained to me in like 5,000 different ways. So there's that. Um, then there's also the struggle with suicidality. It's like we have suicidal thoughts all the time. I feel like any of my patients with BPD have had, even if it's just hanging around, we're not actively trying, it's there. And it's ever present. I don't in my experience with BPD, almost all my patients self-injure in some way, but I've heard from some of you that, happens to not be part of it. So I'm just throwing that out. In my experience, I would say that is a part of it, that there's some form of self-injury. Um, and we really struggle in relationships. If we're honest with ourselves, our relationships really, we have really intense ups and downs. And even if we have what I would call quiet BPD, where it's like we turn all of our emotional sensitivity inward, like any pain, any anger, any frustration inward, that means that we usually isolate. People with quiet BPD tend to like not have any relationships because it makes it feel safer. And then my ones with what I would call like more traditional BPD, not the quiet version, tend to have a lot of volatility in their relationships, kinds of ups and downs. And like we can feel like, oh, we trusted someone and now they let us down. And it's like the worst thing ever. Those are just some of the main things. And then the last little bit I'll talk about with BPD is that the best way I've ever heard it described is being like an emotional burn victim. And the reason I bring that up is because anything that we feel, like anything that we're going through, we feel it very intensely. Everything is incredibly emotionally painful because we're like so sensitive to it. And so we can feel emotionally overwhelmed very easily. Now, I don't know if that resonates with you, but you let me know if it does. I'm trying to look back to see if I saw any of your other questions or stuff, but let me know if there's others, Rebecca. Those are the ways that I would diagnose it. Those are the things I'm looking for. Obviously, everybody's experience is a little bit different. But yeah. So, oh, you gotta go to CrossFit, Melanie? Have a wonderful day. Okay. Okay, resonate. Yeah. Yeah, Thomas. And that's the thing is like, I think, but knowing is half the battle, right? Once we kind of realize what we're struggling with, then we can do something about it. Then we can better manage the symptoms that we find to be the most bothersome, right? For most of my patients, the relationships was the worst. Like that's what they hated. And so we worked on more of the emotion regulation and communication skills, using things like uh, Dear Man or using Dear Man's an acronym for the way that we ask for something that we want, but we'd focus in more on those. And then some of the emotion regulation, like the back burner techniques and things like that. So, yes. So that's hopefully that resonates, but you let me know if you have others. We have time for just a few more questions here. Raphael says, Katie, I'm looking into becoming a therapist. That's wonderful. I'm curious on what questions you would ask people looking to get into the field that might help them provide clarity if it's right for them. I guess a couple things. My first, I have to say this because it's some of the best advice I ever received, is it's more of a statement, but it's kind of a question in a statement. The statement is make sure you're getting into therapy to help others, not to understand yourself. I know that sounds harsh, but I will tell you that as a clinician over the years, I've realized that therapists who get into the field of psychology and being a mental health professional to better understand or like heal their own wounds instead of going into their own therapy. I know that may sound wild, but when I tell you the number of people I went to school with who'd never been in therapy before, mind blowing. So if you get into it to figure your own shit out, meh, if you get into it to help others, amazing. Then those are the good ones, and you end up as a clinician, you'll find the good ones. And you end up find your people because all of you've been in therapy for a long time. And you've like figured your own shit out along the way, but you don't bring it into your sessions with your patients. That's like a piece of advice that I heard that I thought, is really impactful. I guess other things is just I would always want to lean into the importance. It's almost like it's not just important, it's like vital to your survival is boundaries. And I mean that in the most loving way because boundaries are not, I don't think that you guys think this, but I feel like some people talk about them this way, that boundaries are somehow hurtful. No, boundaries are the space with which I can love myself and you at the same time. And we really have to be so clear on those as therapists. It's really important that we uphold them, we communicate them, and we don't shy away from them because not only are we demonstrating healthy behavior for our patients and their families and stuff like that, but then we're also protecting ourselves and our energy so that we can continue to do it. There's that. And then the last thing is, I guess just making sure that you have enough therapy friends. I mean, almost all of my friends that aren't creators are therapists. I feel like I have three types of friends. I have friends that are therapists, creators, or lawyers for some reason. I have like a bunch of friends that are lawyers. Those things, it is really helpful to have other friends who get what you do because like being a creator is also, that's why I have creator friends because then they get what I do. And I never realized until much later in my career how valuable that was. And so I really want you to, I just hope those are helpful. Those are just kind of like pieces of advice. I know you said like questions that I would ask, but it's like those are just kind of pieces of advice that I would give to younger me or to any new trainee looking to be a therapist. Yeah, you're going to be great. Don't worry. It's going to be amazing. Okay. Rebecca. Oh, yes, of course. Of course. Um, I'm glad that my explanation was clear. Okay, wonderful. And what I said resonate. Okay, cool. Sheila's asking, do I see patients via Zoom? I do not. Unfortunately, I don't see patients anymore. I stopped seeing patients when I moved to Texas. Even though I got my license here, I haven't seen patients here. And I let go of my private practice in Santa Monica, honestly, like right before COVID. I don't know if I even told you guys this was happening, but it had slowly happened. Not because COVID was like, I didn't know COVID was happening, obviously, right? But it got harder and harder for me to give my patients the time and energy that I believe they deserve when I was traveling so much. If you guys don't recall, like 2018, 2019, I was gone a lot. Sean and I was all over the place and I like to speak. And so if you want to book me for a speaking engagement, I'd love to come. And that makes it really hard for me to keep up with patients. And I know I could probably do it over Zoom, but I don't, I don't like Zoom as much. I prefer in person. And I keep my license active in both states just because what if I do want to open up a practice? Maybe I will. I don't know. I like to have the option. And I also think it's really important for me to stay up on things and I have to do my CEUs and all that good stuff. So, yeah, that's the story there. Okay. Last question here before we finish. Let's see. Maze asks, how can I know if I have ADD? When I talked to my family doctor, he said this is just stress and not ADD. So how can I know? Huh. Stress versus ADD. Those are two totally different things. Um, I guess a couple of questions for you. Do you find the symptoms, like whatever these symptoms are that you're experiencing, do you find they come and go? Or are they constant? I don't know if you've ever been on medication, but I will tell you my ADHD friends, when they're on medication, it's like life changing. Like my girlfriend said, it was like someone all of a sudden switched the lights on. And yeah, like she was like, "Oh my God, I wish I had this sooner." I find that people with ADHD, because there's no ADD in it's all ADHD now, just diagnostic. It doesn't really matter for you, but it's for symptoms and stuff. We find that people will have what's called time blindness. Like you'll be doing something, then you look up, you're like, oh my God, it's like 5 o'clock. What happened? And you like can't recall the last few hours because you're just super focused on something. Um, I find my ADHD patients, these are random signs and symptoms. I could go through the DSM with you, but this is not stress. Stress is like I can't sleep. I worry all the time. I feel really exhausted and overwhelmed. Um, yeah, uh, and I feel on edge probably. ADHD is more like I have a really tough time getting started on things. I've often felt super lazy in my life or thought I was stupid growing up if we weren't diagnosed. Um, I like I'll start a million projects and never finish anything. We often tend to drive really quickly, oversalt our foods, struggle to go to bed at a reasonable time. We'll stay up really late. Um, Also, there can be like what's called rejection sensitive dysphoria. Like we can really, really worry about people kind of not liking us or putting us down. Uh, I think in general with ADHD, it's like the functioning is difficult in your daily life, like making sure this sounds maybe simple or silly to other people, but it's really important is like people with ADHD can struggle to like have more than one task going, paying bills on time. Like you should set everything to auto because you're going to forget and get distracted and things, can hurt your credit. Um, it can be hard in relationships. People can sometimes think that you're being a little bit more selfish or something, but it's just because you're moving the conversation to things that are interesting to you so you can stay engaged. People can think you're rude because you're like doodling or looking at your phone, but it's a way for you to stay engaged in the conversation because you have to have something else going. Um, yeah, I just feel like ADHD is way different than being stressed out. So if any of what I said resonated, I would encourage you to see a therapist or a psychiatrist and get tested so that you can have that diagnosis and then you can get treatment. Um, so yeah, I think in general, I really want you to get if none of that resonates, then it might be stress. But I'm just saying that like if they're so different, I don't think maybe they have a slight overlap, but I think everybody in the comments who has struggled with any kind of ADHD is like, it's not the same. And so yeah, so that's what I would tell you. Yeah, Resort Dog said that's putting it mildly. There are tests to guide diagnosis. Yes, exactly. Um, okay, let me see. Okay, last thing I want to address this. Samantha says people are telling me to report my therapist for what she said to me, but I worry it wasn't bad enough. What'd she say to you? Oh, where love blossoms at Katie, maybe your future PhD is possibly at a different university in your research area, a little extra to your bookcase. Oh, thank you. You're so sweet. Yep, it'll all fall into place in the way that it's supposed to. That's how life is. We can't fight against it. So yeah. Samantha, if you want to tell us what your therapist said, I know she's like, I'm typing. But if you tell us, I'd like to know a little bit more about that. Oh, yes. And Resort Dog says dopamine addiction from anything is self-medication. Yes, agreed. Yeah. But anyways, that's all, you guys. That's all we have time for. Thank you all so much for hanging out. Wonderful, Lauren. Yes, I've been watching for years. I'm so glad you're at a live stream. Yay, yay. Wonderful, wonderful. Okay, let me see. Oh, look up Jacob L. Moreno. He created psycho. Okay, I'll have to look into it. Yeah, Jen, you've totally opened my eyes to a whole different thing. That's so interesting. That's the thing I love about psychology and therapy as a whole is that there's so many ways you can take it, so many things you can do. You can be like a music therapist, an art therapist. You can work with all different sorts of people. Yeah, it's really beautiful that way. But anyways, thank you all so much for hanging out. Thank you for chatting with me. Thank you for all of your questions. And I'll try to do these more often. My goal is to do these once a month. Also doing them on Instagram and on TikTok, just to be more interactive. I mean, if you haven't checked out today's video, go and check it out. I'd love your feedback in the comments. Oh, okay. Samantha says so we gotta answer. Says I was drinking in the city and something happened. She said if you were sober, you never would have let that. Oh, oh no. Almost blaming what happened to you. Yes, see you on Patreon, Thomas. Um, because you were drunk? No, no. That's I mean, I don't know if that's reportable technically, like legally, but that's not appropriate. And I don't know, that really bothers me. I can't yeah, I wouldn't have let that happen to you. That's not appropriate. Um, victim blaming or victim shaming? No, thank you. I I don't know. My like gut reaction is like we should maybe consider seeing another therapist if you have that option. That seems really crass, really inappropriate. Um, oh, and this isn't the only thing. It might be worth looking into seeing someone else. That just sounds so, I don't know, bad, you guys. Like, yeah, true. And it doesn't hurt to report. If it's inappropriate, we should let people know. I'm just trying to think of, I was thinking about how, like, what would be the law that it would break or the ethics. But it doesn't hurt to report because that's just not appropriate. Yeah. Yes, I know. Happy spring. Yes, resort dog. Happy spring. Um, I know it's so hard, but what if we realize with the new therapist that that therapist like sucked and this new one's amazing and it's just so much better? Because I just feel like you should never have any piece of there shouldn't be any judgment in the therapeutic space. If you're seeing a therapist, you should never feel judged by them, you know? Oh, Jen says it snowed here today. Oh no. Maybe winter's not gone for everybody. But I want you to find the right therapist, the good fit, the someone that can change your life. Because trust me when I tell you that finding that person, God, it can be so. It's like lights on. It can be so amazing, and I want everyone to have that experience. And that just doesn't sound like it for me. Okay. Oh, of course, Ida Martinez. I'm so glad. I'm so glad that, of course, happy to be here. That's the whole reason I do what I do. So I'm glad that that was helpful. Okay. I've got a skedaddle. I have to do some more work and get some other videos ready for you guys. But yeah, have a wonderful, wonderful, wonderful rest of your day. I hope you have a great week. It's a Monday, so great start to our week. Take care of yourselves. Like I said, I'll be doing these every month. Follow me on Instagram and TikTok and over on Patreon if you want more live stream action. But take care of yourselves and I'll see you soon. Okay, bye everybody.